issues, and it was a little weird. Zoom was not letting us make it live, so we are a little delayed by 20 minutes. Uh, Today is 10th of August, 2024, and it's a very, very important topic. I would like to invite general public if they want to come and ask questions. They can come and they can join Zoom on 818-8591-1572. The topic for today is mental health in women. And to present, we have Dr. Shubhangi Parkar. And to introduce her, we have Dr. Monica, our co-host, to introduce her.
Thank you, Saurabh, and welcome everybody to the next CMAAO weekly or biweekly meeting. It's my pleasure to introduce Professor Dr. Shubhangi Parkar, the Dean and Professor of the Vedanta Institute of Medical Sciences in Maharashtra. She has many accomplishments and accolades. She is currently on the Mental Health Task Force of Maharashtra State. She has done pioneering work done in the PET scan research world in the field of neuropsychiatry in India. She introduced something very interesting known as the method of sociocultural autopsy, which studies the explanation of suicide based on the cultural epidemiology, understanding suicide in the context of the person in the society in which they live. It's always important to personalize medicine, and she has done that. She has developed new aspects of the term clinical stigma. She was involved in the first female drug de-addiction ward in India, which was inaugurated in 1997. Today, that would not seem as being unusual, but in 1997, she was part of that pioneering effort. As a dean, she started the free breakfast for residents physicians in 2014. So not only was she taking care of patients in the society, but she was taking care of the trainees who were involved in taking care of the next generation of society. She carried out a series of multiple awareness programs in the community for schools, colleges, as well as BEST, which is the Brihan Mumbai Electric Supply and Transplant Undertaking, Indian Railway, the Mumbai Police Force regarding suicide prevention, stress management, and mental health awareness. Some of her awards and felicitations includes the BC Marfatia Indian Psychiatric Society for scientific presentation in 1999, 2005, and 2016, which is a national level award. She won the Indian Psychiatric Society's West Zone Best Paper Award for the A.V. Shah Award 5 times. She was at the Bombay Psychiatric Society's Best Paper, the L.P. Shah Award 6 times. And she also is a 2-time national award for Best Publication for the Pune Psychiatric Society of the Indian Psychiatric Society. It is our honor to have such a well-decorated speaker today on such an important topic. So welcome.
Thank you. So, should I share my slides?
Yes, ma'am. Please go ahead.
Yes. Okay.
Yeah, please make it into presentation mode.
Yes.
Yeah, perfect.
So, good morning from India, everybody. Today, it's a very important topic, that is mental health in women. We must know that when we talk about mental health, it is a vital aspect of overall well-being, yet it remains a neglected topic, especially when it comes to women's health. Women are generally more likely to experience mental health issues due to societal expectations, gender roles, and biological factors. However, their mental health concerns are very stigmatized, trivialized, or overlooked. I mean, nobody really thinks the emotional sufferings of the woman because it is taken for granted, thinking that she is the most vulnerable person. Today, we want to shed light on the impact of mental health on women's lives, exploring the unique challenges they face and importance of prioritizing their mental well-being. We will discuss the intersection of mental health with gender culture and socioeconomic factor and highlight the need for
Sorry to interrupt you. Your slides are not moving and it's not on presentation mode.
okay, I'll just get that. Uh, yes. Do you have those?
Yes, it's on presentation mode. Yeah, perfect. Okay.
Yes, yes. So, why mental health issues are different in women? Women's health is considered a global priority with focus not just on reproductive, which is a very important function people think, okay, and sexual health, but it is now focused on mental health as well. There are physiological changes and cycles, as we know, right from the menarche to menopause. There are psychosocial statuses all over the world, but especially in India, very peculiar. Additional roles of mother and career is a very important perspective for us to think in terms of the mental health aspect of the woman. So, women's mental health, what are the facts today? Depression, that is, women are nearly twice as likely as men to experience depression. So, it is double. Anxiety disorder, also twice as likely as men to be diagnosed. Postpartum depression, an estimated 10% to 15% of the women in the reproductive zone, they develop postpartum depression. Premenstrual dysphoric disorder, that is 5 to 8% of the women show actual symptoms. 1 to 5 women experience mental health issues, that is WHO finding. Women are 2 3 times more likely to experience depression, we have seen that. And 60% of women having mental health issues don't seek help. That means the women's help seeking behavior for mental health issue is not adequate. In fact, it is really a matter of concern. So there are biological factors related to mental health issues in women. These are hormonal changes related to menstrual cycle, that is fluctuation which leads to the premenstrual syndrome, premenstrual dysphoric disorder. There is a pregnancy and postpartum period, both the critical and creates lot of mental health issues and sufferings for a woman. And then of course menopause, which we talk a lot about. The transition can be associated with mood swings, depression and anxiety. So there are many issues. There is very important biological perspective about women mental health issues, and these are the hormones. And which are these, which we just go quickly through? Estrogen, that regulates mood and cognitive function and general emotional well-being. Progesterone, that influence again mood, anxiety and sleep patterns, which is a very important for general health. Testosterone, that affects on libido, motivation, and overall mental well-being. Oxytocin, which is known as a cuddling hormone, it promotes bonding, trust, and relaxation. Serotonin, a very, very important neurotransmitter that regulates mood, appetite, and sleep, leading to depressive disorders and many other affective disorders. Dopamine, that is involved in pleasure, reward, and motivation. Cortisol, which is a primary stress hormone and which is very important in terms of women and their mental health, because there are a lot of stressors which are intrinsic or which are intrapersonal. Through thyroid hormone, very important again, which is related to metabolism and energy, a lot related to women's um, uh, major depressive disorder issues. Melatonin, sleep wake cycle and influences mood. follicle stimulating hormone, or what we call as a FSH, which is very important in terms of cognitive functions and mood during menopause. Luteinizing hormone, which is related to menstrual cycle, menstrual hygiene, and can influence mood fluctuations during that time. Prolactin may impact mood, motivation, and libido. So, this is a very important biological perspective in terms of the women's mental health. There are associated with it a lot many psychological factors. Some I'm going to talk about it, which are common across the globe. This is negative self-image and self-doubt in modern women era. Looking good is a kind of obsessive demand, and here there are lot of issues which happens, and that probably culminate in many of the significant mental health disorders like anorexia nervosa, bulimia nervosa, etc. Unrealistic expectation and self pressure. And that is perhaps the curse for the modern woman. She wants to go ahead with a lot of ambitions, but then there are expectations which are unrealistic, creating lot of issues. Pessimistic outlook, hopelessness, and helplessness are important factor which we see associated with major depressive disorder or dysthymic disorder, but that's a part of the psychological aspect. Trauma related thoughts and feelings, which are very important concern today globally, because we see the world is not at peace. There are so many things are happening. So there are floods at this juncture. There are wars which are happening all over the world. Okay, so with natural disaster or man-made disaster, the trauma related thoughts and feelings are going to get affected, especially with the women and children, and they would suffer maximum during this kind of disasters and major accidents. There are interpersonal problems related to many social issues, cultural conflicts, etc. Then prioritizing others' needs over one's own. Women is a very valuable person in the world because she takes care. But when she takes care, she neglects herself. And that's not the very important issue, because it creates hassle for her. Women needs to be healthy, and for that she must have health oriented lifestyle. But because of her caretaking attitude, which is rather sometimes toxic, her health suffers. Okay, and most of the time negative body image, which is another important aspect, which is the psychological factors. We will go to social factors that lead to unique challenges for women globally and in India in particular. There are gender roles and expectation in relation to men, because they are supposed to do something which they are supposed to do. So the household work, care of the, so those all things she keeps doing. And today she is in dual role because she is in the modern role too, but her traditional roles are still creating hassle. So there is a double role burden on a woman. There is a poverty and economic insecurity, and remember that women and children suffer when it exists. Discrimination and marginalization, which is again the issue for everybody, but it affects women more, especially tribal, migratory minorities. Trauma and violence, all of us know. We read the news every day, almost in the newspaper, about the violence towards the women, and this is a very common issue. Caregiving responsibilities, which is very almost thought of inherent to our work-life balance, which is a really important issue that leads to a problem and emotional turmoil. Education and employment barriers are much more for the women because of her cultural role. So, if at all somebody has to sacrifice, it's women who sacrifices her education and employment opportunities, she won't take promotion. That would lead to a lot of frustration for her. Healthcare disparities, which is very important because accessible healthcare settings still in the periphery of India and peripheral part of the world is lacking in terms of the easy accessibility to the women. Negative media portrayals. This is a matter of concern because most of the women are shown in the negative roles, especially in the media portrayals. That probably creates a negative impact on the community and the society, and lack of supportive relationship. If the woman has supportive relationship and a very great network, social network, she probably would do well because she gets opportunity to share her problem as well as find out the solutions. Women's issues and concerns that are globally are educational concerns, empowerment, victimization of the violence, cultural norms. There is discrimination, violence, role in the society, which is a secondary roles, the poverty, a very important issue for the women, role as a housewife, which is taken for granted and which probably gives rise to a lot of stressors, housing conditions, and economical concerns. The women, by and large, are not economically independent. And even if they are independent, the decision making in the arena of the economic is always, captured by the men in the house. So there are multiple conflicting roles, traditional versus modernity, and there are unrealistic expectations from females, generally by her family, her society, and that creates a very important issue. So, what are the major mental health disorder that can affect the women? Major depressive disorder, which is twice in women compared to men, a very important issues which is connected to lot of general health concern and suicide, in the women all over the globe and in Asian countries a lot. Bipolar disorder, schizophrenia, post-traumatic stress disorder, which is very important, obsessive compulsive disorder, panic disorder, social anxiety disorder somehow is more. Eating disorder generally is thought to be arena of the women, that is anorexia nervosa, bulimia nervosa, and binge eating. Borderline personality disorder, the studies today are telling that postpartum psychosis, a very critical disorder that affects the health of a woman and the growth of the child. Additionally, women may experience these peculiar disorder which are related to her only, and that is premenstrual dysphoric disorder, perinatal mental health disorder, that is antenatal, depression and postnatal anxiety, menopause related mental health concerns, and there are many because we are living longer than previously. So there are hot places, mood swings, and there are psychiatric, neuropsychiatric disorders, and general well-being also is affected. Reproductive mental health concerns, which are many today because of the modern life, whatever it is, the woman is taking a lot of stress because of her double role. So there is infertility, miscarriage, and abortion. The issues generally are increasing in urban women in India, in Asian country. So these are matter of concern when we talk about psychiatric disorder. Specific risk factor for common mental disorder, this is gender based violence. And when we talk about gender based violence, it is always more for the women. Okay, socioeconomic disadvantage, though women have entered in job profiles, her job is not as dignified for her status or for her education, or her income is less in comparison to her gender counterpart men. Low income and income inequality, that's why low or subordinate social status, which is a very important perspective when she is in the same job. Unremitting responsibility for the care of other. I mean, that can never be stopped for a woman. It's a long time we may have to wait that there will when there will be equal sharing of the responsibility at home or at the in terms of the burden of care. And of course, post traumatic stress disorder, because women is generally exposed to lot of accidents and violence, and traumatic violence, which we know. Hidden facts: emotional distress or psychological disorder are neither identified or treated by the doctors, which are related to domestic violence or violence in general. Patterns of help seeking for these causes related to trauma and violence are delayed and inconsistent in women because of shame or stigma. She doesn't approach the healthcare systems. Violence related to mental health problems are poorly recognized. Women are reluctant to disclose a history of violent victimization, especially when it happened due to their kids and kin, like husband or brother or father. Okay, the complexity of violence, which is related to health outcomes, maybe it is physical or mental health, it increases the utilization of the health and mental health care system, and that's the reason why as a medical profession, we should be thinking all the time about the violence and about the trauma and trauma care for the women generally. Impact of mental illness on society: it impacts home, the children care, other relationship. That's why there will be family disharmony, marital disharmony. It helps economy and it helps health sector. Remember that injured woman, the traumatized woman will keep approaching the health sector without we really handling basic causes like the reasons for the violence or the prevention of the violence and trauma. And these are the important issues we really need to consider, because the productivity and the outcome of the woman, and because she's a woman, also because of the family, the society and the nation is going to reduce. Social origins of the distress: it's a devaluation of the women's needs and abilities. Okay, burden of roles, marital stress, major male priority over women. I mean, even if it is promotion at a higher level, we now see, in recent 5 years that women now started taking those positions, especially in the higher education, which were never given to women first. Dependency, powerlessness, and learn helplessness, which is a very important factor. Women believe that this is what she is supposed to do, so she doesn't strive hard to get into those positions, and she believes that is her destiny, which probably needs to change with awareness of the empowerment issues in the women. The stigma is another thing. How many women, when the depression is so common, will come forward to take treatment? This is a very important that Deepika Padukone spoke about depression in the women. And today, women understand that it is part and parcel of the life, the way infection is a part of the parcel of the life. We see the people with the chest pain will run to the, heart care specialist or cardiologist. But when there is a stress and stress related suffering, they don't go to neuropsychiatrist, to take care. So it is today the requirement that the stress related suffering, women shouldn't keep quiet and feel powerless. She should jump to mental health care setup, go to psychiatrist, get identified for the depression, and get early intervention. Domestic violence is a very, very important issue. It's not just in Asia. It is all over the world. It is in Europe, it is in US, it is everywhere. Around 1 in 3 women globally has experienced physical or sexual violence, mostly by an intimate partner. And this is a very critical issue. Nearly 1 in 5 women in the US has been raped at some time in their lives, leading to higher risk of mental health disorder like PTSD. We also in India read every day in the newspaper about the violence and the torture of a woman or the killing of the woman recently a lot. Social factors like hierarchical gender relationship, the man is in the higher position, control over sexuality, a very important perspective which probably needs an important lecture, fertility, labor participation, and coercion of on women, especially at home, in the labor participation, in the higher job opportunity. So we have to really look into those issues. Economic factors, that is dependency on men, even when she earns, inequality of share of the property. Now the women are becoming little aware, but they are not yet empowered to take decision in terms of the property, and income disparity are very important issues which we need to tackle at policy level. Psychological factors like male ego, I think, which probably needs to be settled eventually as women gets more aware. Depression burden in women is significant again all over the world. Higher prevalence, women are twice as likely to experience depression. Women depressive episodes often last longer for the obvious reason. They come late, their follow-up is very poor, they don't get social support. Okay, women's depression can be more severe and debilitating because along with the depression, there are a lot of psychological issues like helplessness, hopelessness, which and demoralization, which makes women, not to seek help. At the same time, she has no confidence on her, and so her efforts to come out of the depression may be not so adequate. Women face increased risk factor. She's a mother, she's a wife, and she has to probably, keep committing to those roles and neglecting herself, while her compassion and self-care is very important when she is depressed. Comorbidities. Women are more likely to experience lot of comorbidities along with the depression, like anxiety disorders, like sometimes adjustment disorders. Okay, so we really need to look at all those disorders. In some countries with a comorbid depression, there is alcoholism or substance use disorders. Healthcare disparities. Women may receive inadequate or biased healthcare, exacerbating depression. This is very because she's generally labeled that she's a vulnerable woman. So generally, depression becomes a label without a good intervention, which is a very, very important perspective. Suicide is a major concern. That's my topic, and I feel very sad that many women do not go for help when they feel trouble, when they feel suicidal. It is a leading cause of death among women aged 15 to 44. That's a young profile. Suicide is a top three causes of death globally. Mental health conditions like depression, anxiety, post traumatic stress disorder, substance abuse, and even alcohol. I mean, they are not taken care of. Today, I work in tribal part of the Maharashtra where women drink, and they drink so much. I'm going to talk to on that quickly, but that affects their mental health condition. Female suicidal risk varies greatly along the lifetime. That is menarche, maybe antenatal, postpartum, or menopause. Okay, and it is linked to the most of the significant events like divorce, like domestic violence, etc. And social determinants, which we have discussed, play important role in suicide in the women in comparison to men. Life events and stressors, these are major concerns like trauma, abuse, relationship problems, and financial difficulties. Reproductive health like pregnancy, postpartum and menstrual cycle related issues which contribute to the suicide, and limited access to mental health resources, healthcare, and support. The supportive network matters, and which is weak for the women in comparison to men, and that's why there is exacerbation of suicide risk. Important concern related to alcoholism in women, a very important issue, especially for the urban. I see it now in the tribal Adivasis where I work in the medical college right now. The health problems like liver damage, heart disease, cancer, poor nutrition, and related health issues are more. Mental health, depression, anxiety, suicidal thought, PTSD, and they are neglected. They are neglected under the carpet of alcoholism. Okay, strained relationship with family and friends, because when there is a alcoholism or addiction in the male, there is a woman to take care. But when it is in women, there are not many men who take care of the woman. Okay, job loss, financial struggles, and legal problems they face, increased risk of accidents, injuries, and violence related to alcoholism, stigma and rejection. Rejection of the women having alcoholism is pathetic condition in our society. I mean, she can share alcohol, in the parties, but when she become alcoholic, because of her vulnerability, the help is not much. The community doesn't come forward to help. And that's the reason why the attitude of the people are important, because this lady is stigmatizing. Co-occurring disorder like depression, anxiety are important concerns, because alcoholism cannot be treated unless and until co-occurring disorders like depression is treated assertively. Motherhood and mental illness, a very important concern for all the women in the world. That is postpartum blues, little more softer, but postpartum depression, postpartum psychosis, definitely matter of concern, can lead to suicide, can lead to infanticide. Anxiety and depression in pregnancy are potential predictors. We look after health of the woman, but anxiety and depression is equally important in antenatal period. Hormonal changes like antithyroid antibodies we must look at, which give rise to mental health issues, and lack of social support, especially for the urban women because of the loss of joint families now, again is a matter of concern. I have seen many people suffering during the pandemic time because they were pregnant and there was nobody to support due to social isolation. Postmenopausal women, it is a high risk of depression associated with suicide if we don't deal with it. Psychological changes in terms of the mood, in terms of the personality, HRT during the physical symptoms, and artificial menopause, which is happening due to hysterectomy in the early age of late, maybe due to apt reasons, but women need a lot of mental health support, social support, educational support, and awareness during this child, and exacerbation of the schizophrenia. These are common issues. Complex and diverse mental health needs of the women, we must know this. Okay, hormonal fluctuations, we must understand this is throughout her life cycle. Trauma and abuse, which they experience a lot. Reproductive health is always related to mental health issues in women. Caregiving responsibilities is another life event which leads to burnout of the woman. Eating disorders, very common. Midlife mental health crisis in 40s and 50s. It is often peak during 40s, 50s. So these are the issues related to mental health. Pregnancy and postpartum mental health. Again, we have to look at, because there is child who is suffering, there is mother who is suffering, and there is a family who is suffering. Aging and mental health, concerns often go undiagnosed and untreated mental illnesses. Rural women's mental health, they often face barriers in accessing mental health resources and support, which is a very obvious in the peripheral part, rural part of the many countries in Asian countries, including India. LGBTQ plus women's mental health is unique mental health challenge due to discrimination and stigma. I think this is where your foundation should organize a one awareness lecture, very, very sensitive issues. Mental health in immigrant women, it is the issue. People keep changing. I see many tribal women keep traveling for the work, with the whole family, and they face unique stressors and barriers to mental health care. It is really a chaotic state when they migrate. Okay, what should we do to promote mental health in a women? And that is important aspect for all those in the healthcare and all those who thinks about healthcare of women. Educational and awareness on mental health, simple issues like menstrual hygiene, stress management. Okay, encourage women to build strong social connections and support networks. We can have many more NGOs, and support groups. Ensure access to affordable mental health services. That's why, they should be in primary health center, especially in rural part of the India. Support women's autonomy, respect it, decision making capacity, and self advocacy. It is high time women should talk about these issues, talk about their menopause, talk about their menstrual hygiene. Trauma informed care is a very, very important aspect in today's era, with the whole world shaking in different kind of disasters. Encourage flexible work arrangement for a woman who has, burden of care. So I think the policies should be changing. Promote positive body image and self-esteem of the women so that her general well-being improves. Community-based programs and support groups for the women are very important aspect. So at the end, what I would like to say, this is a very good statement. Take care of your body, ladies. It is only place you have to live today. It's not the modern world. It's not the urban or it's the rural world. It's your body wherever you are. And that's the reason why every woman should take care of their body, their mind, and their well-being. Okay, so self-care and physical well-being matters for mental well-being. Thank you very much.
Thank you, Dr. Parker, for a
Thank you.
wonderful session.
Mm.
And I would like to open the forum for question answers. Dr. Monica, would you like to have any comments on the same?
Thank you for a fantastic presentation. Everything that you spoke about are things that women, no matter what socioeconomic strata they live in, no matter what country they live in, and no matter what age they're in, you addressed all the issues that women face. It was a fantastic presentation. With all that knowledge, with educating society, with educating doctors, community workers, making things accessible, the biggest barrier for mental health is the woman herself. And how do you navigate that? How do you bring women who won't or don't recognize that this is a place where they can learn to grow into the help that they need? How do you address that with them?
Yeah, it's a very important concern. The first thing which we realize that women generally they don't express their concerns. Why concern? They don't talk about their day-to-day needs. In India, women eat at the end when the whole family eats, right? And this is a very important attitude. So ultimately, what is important, for your well-being, for your survival, you give that a last choice, and that is the overall attitude. It's not just the food, it is a self-care, it is the health care. Even in the pandemic, the women were taking care of the other people, and when she was suffering, and she was really suffering, so she didn't bother. And I saw many cases later coming out with the depression simply because she didn't think about herself. I think the women, should continue to care for others. That's a very appreciable role of a woman, but not at the cost of the neglect of herself. It's a very important, you know.
Thank you.
Anybody else has a question on the floor? I see some comments where it says nutritional deficiency like B12 is a huge impact on mental health of a woman. And can vitamin D deficiency also is the almost universal nowadays can affect the mental health?
I think these are very important supplements, for a woman. And generally, as I said, the attitude of neglecting start with the self-care and start with the nutrition, right? And these are very important perspective. Like today, I work as a dean at the institute, which is in the tribal area, and I can see the women, generally neglect their health. They don't even have a orientation towards what does it mean by the balanced diet. Okay, they generally, have the habit of eating what you get, and they generally don't think about that what can be changed. Okay, so we need to, get into basic now. I'm talking about the basic rural India, where nutritional food education and awareness will matter a lot now. I mean, there are vegetables, they don't eat those, which can give them a good hemoglobin and vitamins. So that awareness, especially in the local, we are not telling them that be, economically costly affairs. No, there is something which is available in the land where they stay. They should start using it. So my concern, yes, the nutrition of the women, matters. Modern women eating all those chunky, punky food, which doesn't give vitamins. So we do have problem at both the levels.
Anybody else has a question? Otherwise, we'll wind up the session. We are at 10:30 time. Okay, so we don't have any more questions, ma'am. Thank you so much for enlightening us with your knowledge. And it's a very, very important topic, a need of an hour. So you're welcome more again for a follow-up session. But with this note, we will like to end our session. Thank you, Dr. Monica, for your contribution to this forum. And thank you all the doctors over here present. With this note, we'll end the session. We will be again live in a couple of weeks. Thank you everyone for joining in. Take care.